In a Paris suburb, volunteers transform a gymnasium into a clinic for coronavirus patients.
This centre will ease the burden on emergency rooms and GPs. It'll group patients in one place where we can follow procedure and isolate them so they don't infect others.
Most people in the French capital are obeying President Emmanuel Macron's call to stay indoors. Streets are quiet and roads nearly empty. Nevertheless, the region is bracing for a wave of new coronavirus patients. The French Prime Minister says it's a similar picture across the country.
We are in a crisis that will last, in a health situation that will not improve quickly. We will have to hold on. We will have to remain extremely mobilised. The wave of cases that is sweeping across France, the first which hit the east and which is currently arriving in the Paris region, the north and other French regions, is an extremely high wave and is putting the entire healthcare system and entire hospital system under tremendous strain.
The majority of people who've died of the coronavirus have been elderly or had underlying medical conditions. But doctors in Paris say a 16-year-old girl is the latest victim, proof that anyone can be at risk. Eastern France has had more cases than other regions. Each day, health workers have battled to treat an influx of critically ill people.
The hardest thing is not knowing what's going to happen tomorrow, not knowing how many patients will be put on life support, not knowing how many beds will be available. And despite all our anticipation, we always feel we are one or two steps behind the reality on the ground.
It's clear that the situation in France's hospitals could deteriorate as coronavirus cases rise. The Prime Minister has extended France's confinement period until April 15th to try and stop the spread. And he's warned people that the worst is yet to come. Natasha Butler, Al Jazeera, Angoulême, France.